Hello, good morning, and welcome to Northeast Current, the show that each week brings you the most exciting and interesting guests that our area has to offer, people who strive to enhance and enrich your life. I'm your host, Lisa Marie Gurley, and do we have a show for you today which answers the question, are you aging? Well, I know that I am, and if my producer comes in any closer, you'll see how much. Be that as it may, we need to ask ourselves time to time, are we aging well? And here to answer that question, to help us ponder the quality of our life and how it can be enriched by her services, she is Dr. Linda Thomas Hemak. She is in studio today with us. She is not only a primary health care physician, she is the CEO and acting director of the Wright Center. If that were not enough, she is a wife and a mother of 3, and she is on the advisory board of Aging Well magazine, a periodical that is now on my coffee table. So out goes Cosmo, and in comes our distinguished guest, Dr. Linda Thomas Hemak. Welcome, Doctor. How are you? And thank you for being here today on Northeast Current. If I've said anything, it's because there are so many credentials to your name, so many accomplishments. I try to condense them into a few sentences, and I realized that I could not. So please tell our viewing audience something about yourself and what motivated you to go into medicine in the first place. What attracted you to medicine?
So my name is Dr. Linda Thomas Hemak. I am a primary care doctor. I'm a board-certified internist and pediatrician. I absolutely have as my favorite professional activity taking care of patients from multi-generation families in the community where I was raised. So I was born and raised in Archibald, Pennsylvania, right here in northeastern PA. And I went off to be trained to be a physician, and shortly after doing my residency in Boston, came back to my home community to start a very traditional practice that was deeply rooted in the community where I had connections with generations of people and resource agencies. And probably 3 or 4 years into that, I recognized that there were a lot of pitfalls, a lot of great things about the model, but pitfalls too, and really found my way staying really passionate and committed to the practice of primary care delivery by attaching to education and really leveraging education to raise the game of the environment in which I practiced. And so that brought me to the Wright Center in the early 2000 age. And I've been very involved in community-based medical education since then. I work for the Wright Center, which is basically a graduate medical education organization that trains physicians after medical school. It has a mission to leverage that training of doctors to improve the health of the communities that we serve. And it has many academic affiliations with all of the higher academic institutions in northeastern Pennsylvania. And so we really cross over from just the training and development of physicians into the training and development of interprofessional workforce, which includes nurses, nurse practitioners, PAs, medical assistants, LPNs, phlebotomists, and it's really been a wonderful career path where I can live out my vocation of wanting to take care of patients with excellence, with the resources that I have available to me in a semi-rural community, by eliciting and connecting the community resources to help me do that, and really being called every day to the top of my game because it's in an educational environment where somebody's watching and learning.
That's marvelous. Tell us a little bit more about the Wright Center. I know it's a crowning jewel in our area. How does it affect the masses here?
So the Wright Center has been around for 35 years. There's a lot of people that would know it to have previously been the Scranton Temple Residency Program. And it was founded by Robert Wright, so it's W-R-I-G-H-T.
Right.
He was our founder and president and CEO for 35 years. He was a pioneer in community-based medical education. He really, in the late 70s, had a vision that he could really promote renewal of healthcare and the physician workforce and bring joy into the practice, maintain joy really in the practice of medicine.
How sweet.
By calling people into what's really inherent in the vocation of being a doctor, which is teaching and education. So the word doctor means to teach.
Right.
So we were founded
With
by
an
Bob
R.
Wright, and you know, I think that a fabulous part of our founding was that it was really rooted in collaborating and calling stakeholders in healthcare that were otherwise competing to a collaborative table to really talk about how do we best make the physician leaders to meet the needs of our community and the health of our community. So the Wright Center is a community asset. We're a not-for-profit. We're community governed. We have a very broad stakeholder group that includes patients and hospital leadership, medical group leaderships, and leadership from some of the academic institutions who are our partners in education.
And excuse me, but who would partake in your services?
So we basically have collaborative partnerships with many organizations, including the hospitals locally, the Veterans Hospital in Wilkes-Barre, Geisinger Community Health Center, Regional and Moses Taylor Hospital, which are now owned by Community Health Systems. And our residents, physicians train in many of the same 750 volunteer faculty signed up to teach at the Commonwealth Medical College. And we also own and operate 3 Wright Centers for Primary Care, which
And
are
where are they
basically,
located?
so I work personally at the Wright Center Mid-Valley, which is located in Archibald,
Okay.
and which just opened a very beautiful, you know, brand new $6 million interprofessional showcase. It's a showcase
It's a jewel.
for what the Wright Center does. So that's in the Mid-Valley. That serves maybe 6,500 patients. We have a Wright Center for primary care in Scranton here on Madison and Pine, which is going through its own transformation into a new identity, as it was previously owned by Moses and Mercy Hospital, and we now own and operate it. And we have another Wright Center for primary care in Clark Summit,
I see.
led by Dr. Susan Baruti, who is actually one of our graduates.
Well, for a layman like myself, and it may be rudimentary, but explain what a primary physician does these days and how vital it is to our health care and our well-being.
So, you know, the essence of a primary care doctor, which is really rooted in the sacredness of a relationship between the doctor and the family and the patient and the community, okay, that essence is the same. I think how that gets demonstrated by helping the patient to recognize what they need to do to promote their health, participate actively in strategic screenings to take, you know, to stay healthy, and how to effectively manage chronic diseases like diabetes or hypertension or heart disease. So the role and the complexities of how you help a patient to do that, and how you help a patient to navigate what is an extremely complex healthcare delivery system, has really challenged and driven the development of new skill sets in primary care doctors. You know, it's a very exciting time in American healthcare. The entire way that we deliver care is changing.
Yes.
From, you know, the one doctor with very few staff to larger systems in which that doctor practices, where staffing ratios are now different, and a lot of what the doctor used to do can now be done by a nurse or a medical assistant, so that the doctor can come to the top of their capacity and maybe take care of larger populations of patients. And you know, the systems in which they work are now wired with information technology, and most doctors have now converted because the federal government incentivized everyone in healthcare to kind of go electronic. So it's actually the minority of offices that are still paper-based.
Right.
And you know, that has been a very important transformation in healthcare, and I can't like overstate really the value of electronic medical records to really enable the primary care doctor to be the advocate they want to be.
Yes.
To manage the care of their patients.
Interesting.
And so, you know, electronic medical records are extremely helpful. They help you to manage populations, and they still enable you at the point of care to deliver the planned and strategic care that you want to today for that one individual. The interesting thing is that, you know, as electronic medical records came into the industry, that's a major change. And with change comes stress, because if you need to focus on implementation of new ideas and new technology and new innovations, it distracts from other things that were within the realm of the primary care doctors.
Right.
So it's been I think it's been a very intense time
Yes.
for primary care, and it's
Yes.
a very exciting time,
Right.
depending on your frame of reference and maybe how tired you are that day or what went on
Right.
in the population that you take care of and care about. It might be a very stressful time.
Absolutely.
And so...
And what have you found some stress relievers? Anything new and happening in that area? Because I realize now more and more that stress does add a lot to our lack of care, or our lack of well-being.
So one of the key foci of like really getting the primary care situation straightened out so that we can be the advocates that we want to be for patients is that there's a real focus on physician self-care
Okay.
and wellness promotion. And there's curriculum changes both at the medical school and also at the Wright Center in our residency programs to teach better work-life balance,
Excellent.
to teach self-awareness and self-regulation. What are your strengths? What are your weaknesses? And I think that self-awareness in general diminishes stress. So, the other thing that's inherent in terms of stress relief for primary care and healthcare delivery is that the entire transformation in healthcare that's going on has a clear overtone of making the whole system less reactive, less chaotic, more strategic, and more planned. And that in itself is a stress reducer.
Very interesting.
So it's very interesting. I think that the transformations that are happening in healthcare are moving us in the direction of building healthier work environments within healthcare.
Marvelous.
And de-stressing the care delivery environments when you successfully get transformed. So, getting there from an old reactive, chaotic system that was really driven by responsiveness to acute crisis and sickness into a wellness promoting, accountable organization where care is the majority of the time and the culture is strategic rather than reactive. That's a chiasmic transition.